Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about doing a gynecomastia reduction on men using laser liposuction versus having a surgical breast reduction, which then causes scarring in the area. So when we use the laser liposuction procedure, it works great in patients who have an excessive amount of fat in an area such as the breast. And certainly we can use this procedure both in men and women, and we've successfully been able to reduce the size of breasts in women without them having to go through a surgical procedure, which of course is also available for patients who just have way too much glandular tissue or way too much skin. But when we're dealing with an excess amount of fat, laser liposuction is a great procedure because it can save you a lot of recovery time and can give a very beautiful result. So it involves the infusion of a diluted lidocaine solution, which we call the tumescent anesthetic. It's done under just the local numbing, so you're fully awake for the procedure. And then after that, we basically melt away the fat using focused ultrasound and then suction that fat out. The skin will actually shrink when that fat goes away, and the ultrasound also generates some heat, which helps to shrink and tighten the connective tissue as well. So it's just a great win-win situation. A lot of times men just get gynecomastia from aging, or it may be hereditary. Sometimes we see it in younger individuals as well, but it can be kind of embarrassing, especially if you want to wear those tighter shirts and it looks like you have man boobs. So this is just a great way to get rid of that fat that you're holding in the chest area, and then sometimes it extends to the lateral chest wall, and we can get that as well at the same time. So just a really great procedure, very easy, done in the office, just under local. You go home, you wear a compression garment, maybe for a few weeks. And that is it. Please let us know if you have any questions. We would love to hear from you if you have any comments or questions about this procedure. Thank you so much for watching.